Today I'd like to show you some of the tools that make 24-hour recovery possible. When Dr. Tebbetts started developing 24-hour techniques, we realized that we didn't have all of the tools we needed to actually make it possible. So we had to start developing some new ones and repurposing some old ones. The first thing we had to do was write the book. This book is so important. Having patients know what we know makes it all seem easy. It puts expectations on the same level, and you truly understand how important 24-hour recovery is and how it can even be possible. And then there are these guys, good old tape measure and caliper. These are in almost every exam room and operating room, but rarely have they been used to plan operations like we do today using high-five measurement systems. So these had to be repurposed. Dr. Tebbetts designed an entire set of breast surgery instruments to really make 24-hour recovery processes very efficient in the operating room. But I think my favorite one, or the most important one that he designed, is actually this one. This is a monopolar hand-switching electrocautery dissector. This guy is very, very important in 24-hour processes. This allows him to cut and coagulate at the same time, so there's no bleeding while he's making the new home for the implant. This is what allows us to send you home with no bras, no bandages, no drains, no bruising. You're out shopping, resuming normal activity because of the precision that was used to dissect the pocket. On the other hand, there's this guy. This is a blunt dissector, and Dr. Tebbetts did not design this. It's been used for ages, and unfortunately it's still used today. It just rips through tissue. If you've ever seen a surgery on television and it was all bloody and gory, this was probably the culprit. The difference between using this and this to dissect a pocket is kind of like the difference between driving through a really heavy torrential rainstorm with your windshield wipers off or with them on. When you have this tool in your hand, you have precision, you have control, you have efficiency. And when the surgeon has that, it makes a world of difference in what you're going to feel postoperatively. And this is a really, really, really important concept to get a hold of. What happens right here in this operating room directly affects how you're going to feel postoperatively. So whether you're having your shoulder operated on, or your gallbladder removed, or having breast implants, what happens in the operating room is going to dictate how you feel postoperatively. So learn about your recovery before you commit to a surgery, before you commit to a surgeon. Ask the surgeon what the recovery will be like, ask to speak to several of their patients, and ask for your postoperative instructions in writing before you decide if you want to have this done. Choosing to have breast augmentation, choosing to have breast implants is exactly that. It's a choice. So if you're going to choose that, you certainly ought to be able to choose the type of recovery you'd like to have too. So what's it going to be? Horrific and destructive, or kinder, gentler, precise, and 24-hour recovery? I mean, the choice seems clear to me, but I know all this stuff. And that's why I'm telling you, because the more you know, the better your decisions will be, and you'll not only enjoy your result, but you'll also get an opportunity to actually enjoy the entire process and the experience. If you'd like to know more about 24-hour recovery, please go to our website. You can even read the scientific papers if you'd like. And certainly, if you know somebody that's interested in breast surgery, please tell them about our channel.